Open enrollment for individual health insurance, also known as Obamacare, begins November 1st and will go through January 15th unless extended by the government. Medicare open enrollment will go from October 15th to December 7th. And this is the time of year when people usually shop for health insurance. And the first place everyone wants to go to is Google, because that's how we're all conditioned to. But there are many dangers of going to Uncle Google for your health insurance, and I'm going to go over just a few things you need to watch out for before you decide to take that route. I will also share what I believe is the best way to shop for health insurance. So let's get started. It is said that if you want to bury a secret, the best place would be on the second or third page of Google, because very few people ever go past the first page. And who's usually on the first page of any search? First of all, it's usually the paid advertisers on the top, followed by some clever marketing companies who know how to use the web and may also have a lead generation site. If you've ever made the mistake of putting your name and number on any of those sites, you may have found your phone ringing off the hook with dozens of agents trying to sell you their plans. Hey, with all due respect to all those agents, they're only trying to make a living, and in some cases may have an actually very good health plan to offer you. But that is just not the place where I would recommend you start your search. You need to realize that right now we have a lot of different types of health plans available, and some of them are like association plans, short-term medical plans, hospital surgical plans, scheduled benefit plans, health share ministry plans, as well as the Obamacare health plans, which are offered through the health insurance marketplace in most states. And all of these plans come with some pros and some cons, and what you don't know can hurt you. In my opinion, the best place to start would be to find a health insurance agent or a broker who represents many different insurance companies on and off the exchange and can help you choose a plan that is right for you. Because it is way too easy to mess it up if you try to do it yourself. Hey, I know it's a complicated process to try to do it yourself, because if you don't know all the rules, you can easily disqualify yourself from potential savings or choose a health plan that a very few doctors will accept, or in some cases, may not even have the benefits that you want. The second place people often go to is directly to an insurance company, which seems like a good idea, but think about it for a minute. If you call company A, would they recommend any of the plans of their competitors? Probably not. That's not what they're paid to do. They can only tell you about their products. But an independent agent who represents many different insurance companies can make recommendations based on your specific needs. The third place people often go to for their health insurance is directly to the health insurance marketplace. And if you've ever done that, you know how frustrating that can be, waiting on hold for long periods of time and the application process that seems to take forever. Also, how is a person working in the health insurance marketplace going to know about all of the health plans in all of the states where they serve? Heck, I've been doing this for over 30 years, and we focus primarily on the state of Georgia, and even then we struggle to keep up with all of the changes. Sometimes those changes include negotiations with hospitals, doctor groups, and insurance companies. Remember how I said people rarely go to the second page of Google? Well, insurance companies have also realized this little secret, and many companies intentionally load up their cheapest plans with higher deductibles and lesser benefits so they can show up on the first page of the search results. And many times, these are newer companies with smaller network of doctors and hospitals. And if you're doing it yourself, you probably wouldn't realize this. Last open enrollment, some of the plans and companies that we had recommended were on the fourth or fifth page of the search results, because based on our experience, that's what made sense. We have to realize that when new insurance companies enter an area, many times they haven't had a chance to build up the network of doctors and hospitals, so we try to stay mindful of this, especially for those individuals who may have chronic health conditions and need to make sure their doctors and prescriptions are going to be covered by that plan. For healthy individuals who rarely go to the doctor, this may not be as important. Bottom line, an experienced agent can help you cut through some of this clutter and make it much more easier for you. He or she may also provide additional services and help you upload immigration and income verification documents if necessary, and can also help you download your 1095 tax forms at the end of the year, or just show you how you can do it yourself. The way I see it, it's like this. Most of us have a primary care doctor, a dentist, sometimes a CPA, or even a trusted mechanic. Your go-to guy or gal to get things done. So why not develop a relationship with a good health insurance agent who knows your situation and can guide you through this complicated process once a year? Keeping in mind that some of us are paying premiums as high as mortgage payments, and it doesn't look like any of this is going to change anytime soon. So how do you find an experienced agent? Well, if you're going to go the Uncle Google route, one suggestion would be to search for health insurance agents near me and make sure they're in your area. You can check out their website, Google reviews, and find out how long they have been in business. The idea is to find someone who is experienced, represents many different insurance companies on and off the exchange, and is available to help you through this process. And by the way, all of this is applicable when searching for Medicare plans too. You want an agent who represents many different insurance companies and can help you make educated decisions. There are still no guarantees, even when working with qualified agents, because we're all fallible and can make mistakes. But this way, at least you'll be making a little more conscious decision. So what's the best way to find a good agent? Simply ask your family and friends for a recommendation. You can even ask your friends on Facebook, and I'm sure many people would be happy to help you out. So I hope this video has been helpful to you as well as some of my fellow agents. Our firm currently offers individual and Medicare plans here in Georgia and some surrounding states. But if it can be of any assistance to you, please feel to reach out and we'll be happy to help. Have a great day.